leads me into my main point here, which is pharmaceutical companies will do whatever the hell they want. They don't care about you. They don't care about your health. They don't care about really making medicine that will help you for the most part. There are good people who work at these companies, but the decisions that are made by executives are often just in the pursuit of profit and often inadvertently harm lots and lots of people. Now, let me just pull up a couple of things here. I want to talk about the opiate epidemic for a little bit. So, if you don't have the background here, Purdue Pharmaceuticals was a pharmaceutical, well, is still technically a pharmaceutical company, which produced OxyContin back in, here we go. OxyContin, 2001. Oh, OxyContin became a blockbuster drug between 1995 and 2001, brought in $2.8 billion in revenue for Purdue Pharma. OxyContin is just oxycodone. And this was marketed all around the country. Again, late 90s, early 2000s, as a non-addictive opiate medication for moderate to severe pain. They said that it would work for 12 hours, that it had a less than 1% risk of addiction and abuse. And this is oxycodone. And obviously, none of this was true. There is tons and tons of information on it. I'm not going to go through and read the Wikipedia article, but the Sacklers, who were the family in charge, had to step down. There has been several lawsuits, some that have been settled, some that are still in the process. The company is in the middle of a bankruptcy procedure that is very complicated and involves the Supreme Court in some way. It's messed up. But we all know what the opiate epidemic is, right? We know how this worked. This company produced a drug that they pushed, not cheaply, might I add, as it was a new medication. It was supposed to be long-acting and non-addictive. So they made people, and they paid doctors to advertise these medications. And they got people addicted to oxycodone. And then suddenly, there was a lot of people addicted to oxycodone. And then we found out that this works for 12 hours is a lie. So they need more oxycodone. They need higher doses. They need to take it more often in the day. And then the nation realizes that this is probably not great. We have now a massive population that is addicted to a drug. And so the crackdowns begin. The pill mills, the corrupt doctors that just prescribe for profit, they get arrested. And access to oxycodone becomes restricted. The company that made it gets fined. There are other consequences that come about from it, of course. But this doesn't do anything about the problem of the thousands and thousands and thousands of addicts now that were created by this company. And with access to oxycodone now limited, the prices of it went up. And as you can see here, there is a direct correlation. The rise and fall of prescription painkillers in the US, the shipment of hydrocodone and oxycodone pills from pharmacies to practitioners rose until 2011 and then started to fall by 45%. Now, illicit drug deaths, as in other opiates like heroin, fentanyl wasn't a thing back in the early 2000s, but grew immensely. There is a direct correlation. Counties that had the highest average dose of legal pain pills per person from 2006 to 2013 suffered the highest death rates in the nation over the subsequent 6 years. The annual overall overdose deaths reached a grim milestone in 2021, surpassing 100,000 for the first time in U.S. history. 100,000 people a year dying because of one company. And to be clear, it's more than one company responsible for what happened throughout the epidemic, but the creation of this, the pushing of oxycodone onto thousands of individuals, onto doctors as saying it won't be addictive. Purdue Pharma is directly responsible, in my opinion, allegedly, for the deaths of hundreds of thousands of people, let alone the other drug companies that jumped on board, and we will get to that. But this is, quote, we have created a huge cohort of people dependent on opioid pain pills, and when we pulled back on those, we created a heroin wave, and that quickly got replaced by fentanyl, and then people really started dying, finish quote, said Daniel Cicerone, a researcher at the University of California, San Francisco School of Medicine, who studies street drugs and overdose trends. The newly released DEA record offers the first public look at data tracking every prescription pain pill manufactured and distributed in the United States between 2015 and 2019. The Post, along with the Washington Post, along with the company that owns the Charleston Gazette-Mail, sued to make the records public and previously published the data covering the years between 2006 and 2014, analyzed hydrocodone and oxycodone shipped to pharmacies and practitioners across the 14 years because they were the pills most widely abused and diverted to the black market. The data was posted Tuesday by a consulting firm, a data analytics company working on behalf of the plaintiffs' lawyers. Today, the opioid crisis has morphed into deadlier form, and this is where we can leave that one. So, again, a private drug company creates a drug, lies about how it works, sells it, creates a massive, massive issue nationwide. They are now, the Sacklers now are in the Supreme Court arguing whether they can have immunity as long as they plead guilty and pay a bunch of money. These people should be in prison forever. At least the ones found directly involved or even really knew about what was going on, which I believe is all of them, but don't quote me on that. But they shouldn't get any fucking immunity. Hundreds of thousands of people have died directly because of them. And not only because of them, because of, or other drug companies like Johnson & Johnson distributes finalized a $26 billion landmark opiate settlement. This was 2022. Drug maker Johnson & Johnson and 3 major distributors finalized nationwide settlements in their role of the opioid addiction crisis on Friday. Clears the way for $26 billion to flow to every state and local government in the U.S. Now, Johnson & Johnson, AmerisourceBergen, Cardinal Health, and McKesson announced the settlement plan last year. Now, this money doesn't go directly to the victims. It goes into funding deeply, deeply, deeply underfunded forms of rehabilitation. But I'm getting ahead of myself. So, these companies outside of Purdue jumped on board, jumped on the bandwagon, and produced their own versions of opioid medications Didn't need to be oxycodone anymore, or OxyContin, which is the trademark by Purdue. It could be any opioid medication, because now there's a large population of the country addicted to opioids. They'll get whatever they can get their hands on. And through corrupt means and through marketing to shady doctors, these drugs get diverted onto the black market. And so people get them, people die. And this settlement is essentially these corporations saying that they allegedly did the thing, but without saying that they did the thing. But the issue here is this money, this $26 billion, is a drop in the bucket. This isn't going to help all that much. Yeah. California Governor Gavin Newsom proposed budget calls for using $50 million of the state's expected $86 million share for youth opioid education and to train treatment providers, improve data collection, distribute more naloxone, a drug that can reverse fatal overdoses. All of that's great, right? Doesn't do all that much, though. It might save some lives, which is great, but this doesn't solve the issue of addiction. How we treat addiction and how we look at addicts is very, very important. And in the United States, it is, how do I put this? We're more focused on the culture war aspect of the opioid crisis than actually how to fix the problem. So fentanyl now is the big problem, killing more than 100,000 people a year. It's very dangerous. There's more stuff that comes with it. Fentanyl is added to other drugs that aren't even supposed to be opioids, fake pill presses, etc., etc., etc. Now, all of this is bad. Don't get me wrong. This is all not good. However, hold on. Sorry guys, might be buffering for a moment. Did the stream drop? Yeah. Okay. We had a bit of a stream drop. Sorry about that. Right. So, yes, there is big concern with fentanyl. There is a lot of people dying. This is all very, very bad. There is drugs that are being mixed that are more potent than fentanyl. There is stuff coming in from the Mexican drug cartels that are pressed into pills, which are counterfeit, that are meant to be like ADHD medication, but they really have fentanyl in them. The federal research now says drug overdoses are the leading cause of death among young Americans aged 18 to 45 and have also spiked as a killer of pregnant women. This is all very, very bad. However, the lens that we are looking at this problem from is a political one, not a medical one. Drug addiction is a healthcare problem. It is not a problem of law and order, and it's not a problem of politics. We have major politicians saying that using fentanyl being brought in from Mexico, from China, to push xenophobic policies for their own gain. And yes, I'm sure some of them do actually care about the lives of addicts, but not really. It's all being used to push a policy. Police will use fentanyl to justify illegal extreme actions as a safety concern. Like, there is the lens that we should be viewing this through is this is a healthcare problem. How do we fix it? Addicts have a physical something in their brain because drugs alter your brain chemistry. That's how they work. And so they need treatment. But we focus on addiction as if it's a crime problem, as if they need to be arrested. And in many places, we have somewhat introduced systems in the United States to ease off on arresting nonviolent drug offenders, because what happens when you put a drug user, an addict, in prison is that they just continue to use drugs in prison. Drugs are available in prison. They're not that difficult to get your hands on. And in fact, a lot of the time, because they're expensive, especially in prison, then these addicts then get sucked into the cartel rings and the local organizations of drug dealers and become indebted so that they could use their drugs in prison. And then they leave prison and commit more crime. Treating this as a crime problem has never worked. The drug war has been a colossal fucking failure. It has only ever made the black market stronger and bigger. Now, how do we fix this? Well, detox programs, rehabs. These are all very important and very useful. Now, let me just grab up a statistic here. Now, the average cost of drug rehab. I'm not going up there. Annual cost of drug rehab based on census survey. I want per person. Detox costs per person $121,000. And beyond that, there's residential treatment. There is outpatient treatment. This is a healthcare. Outpatient rehab ranges between $1,000 or $10,000 over a 30-day period. Inpatient rehab is $1,000 a day on average. And to be effective, a 90, like for opiates, for example, you need 90 days in a rehab fucking minimum to just not immediately relapse when you get out. And this has been seen over and over again. We see this in the news. We send people to rehab, even in states where instead of arresting and putting drug users in jail, we put them in a state mandated rehab for like 30 days, which oftentimes the state does not pay for, though it should. Fly. And then they continue to use because it's not adequate treatment. There is an outline system of how to treat drug addiction, and we ignore it because it is expensive. But this is an expensive problem. Safe use facilities, for example, is deeply unpopular, but work. A facility where there are registered nurses and doctors, sometimes on staff, a social worker, for example, someone at the door to like greet you with a little pamphlet of, hey, go to rehab, and a place where you, as a drug user, can safely use your drugs, where the drugs are not provided to them. They're provided to tools that they need, like clean needles, for example, to prevent the spread of diseases. And a nurse or a doctor there in case the patient overdoses. All of these make sense, but they're deeply unpopular because people don't like the idea of allowing drug addicts to do drugs, except they're going to do them anyway. And then they go and complain that these drug addicts are out wandering the streets and they're high and they're committing crimes. Well, they wouldn't be out wandering the streets high committing crimes if they were sitting in a nice, comfy youth center where they have a TV and like a couch and they can just hang out. Obviously, they will have a less likely chance of dying. They will be less likely to commit crimes. This would be, if you make these places nice, where people want to actually gather, the addicts want to go here, then they will go there. And then while they're there, you can gently nudge them towards recovery, towards treatment. You don't pester them because that doesn't work. You can't stop someone from doing something unless they want to stop doing the thing. But beyond this, there's also the manner of cost. These centers cost money to maintain. They tend to get cut quite often. People cite Portugal as an example against this argument of like, oh, well, Portugal tried this and now they're like rewinding it because it didn't work. Well, it did work, but it was originally underfunded and it was cut even further. The funding consistently was cut from this program, so of course it's not going to work. These are expensive programs. Detox and rehabilitation and safe youth centers, in conjunction with each other, that are federally funded through healthcare services like Medicaid, but not even necessarily just Medicaid, would work. This would help people die less. This would help people get off drugs. You could put a social worker in there whose job it is to see addicts from time to time of like, oh, I need help finding housing. I need help applying for Medicare. I need help filling out these documents. Like that's what a social worker does. And these facilities would be a perfect place for them because again, they have to be comfortable. The addicts need to have to want to be there. Need to have to want to be there. They have to want to be there. It's really that simple. If they don't want to be there, then they're not going to go there. They'll go and they'll grab their, like needles and stuff, and then they'll leave. There needs to be rules, like sure, you can come and you can grab some like needles and stuff and you can leave if you really want to. But if you do the drugs in the facility, you're required to stay in the facility. There's a security officer. You have to stay there for X amount of time. You agree to it, like common sense things that are rational to everybody. This would work. It just would, because addicts are regular people. They just have one extra, what's the word? They have an extra layer of incentive in their mind, and that goes first, is drugs first, and then everything else. It's the basic concept of Maslow's hierarchy of needs. There we go. So this is Maslow's hierarchy of needs. You start at the very bottom and you work your way up. Think about before breathing, food, water, shelter, clothing, and sleep. There is another little bar down here, and that is drugs. That's it. That's the only difference between an addict and a non-addict, for the most part, is just one more in the hierarchy of needs. And much of the time, these addicts do want to get out of their situation. They want to do better. They want to not be addicts. And drug detox costs an obscene amount. Drug rehab costs an obscene amount. They're not even really always available to get into. Like, look at these costs. And these are for what, 30 days? like I said, this is the average cost of treatment received, not the average cost of treatment generally. But it's about 1,764 for a single admission from a state's average. I believe the number of about $1,000 a day for a rehab is still pretty accurate and would apply to most detox centers as well. That doesn't also include drug court fees, therapy, just general fucking therapy, in prison therapy, and then there is also the question of sober living homes. What do you do after you get out of rehab? Let's say you do manage to get into a 3-month program at a rehab, and you're doing good. You're off drugs. It's been 3 months, and now it's time to go. If you throw this person back out into the world with no assistance, right back to where they were, the same environment that they were in, how could you expect them to behave differently? And again, this is another thing that costs money and is unpopular, but you need structure after rehab, these sober living homes, these temporary places where you reacclimate to society. Really the same, it's like halfway houses for prisons. It's the place you go in between while you're relearning because you just had a bunch of time where you were outside of society focused entirely on yourself and you now have to reacclimate. This is the only real way to fix the epidemic that we have. This is the only way to stop people dying from fentanyl and heroin and oxy and all of these other drugs. And remember who's responsible for this. It's not the addicts, it's the drug companies. They paid billions of dollars in settlements. That's an admission of guilt in my book. We know all of this. But when we talk about addiction, addicts are talked about like criminals. They're talked about like they're dirty. It's a very classist argument, in fact. Why should I have to pay for that dirty addict to get clean? I've heard people say that addicts should just die. I've been on Twitter arguing with people on this very subject, and there are several that just think, like, I can think in my mind that have stuck in of just, we should just put all of the addicts in the middle of the forest and like let them have a Hunger Games type thing. Like it's obscene. They're seen as a lower class of human being. They're not even really seen as human by some of them, and it's a disgusting ideology. It's very reactionary. It's very hateful, and it comes from a place of greed, of classism. Now, beyond all of this, there's also the issue of outside of opiates, because of the opiate epidemic and the crackdowns on just any real illicit substance that came from it. There's now an actual difficulty in accessing psychiatric medications. There is stigma, there is regulation, and beyond that, there's fear. So, Reuters from 2022, crackdown by U.S. wholesalers in response to the opioid crisis is preventing some pharmacists from dispensing a combination of stimulants and sedatives routinely prescribed by psychiatrists to help manage conditions like anxiety and ADHD. 5 independent pharmacists in 5 different states in the U.S. told Reuters that in recent months they were notified by wholesalers that they would be cut off from the distribution of all controlled substances after filling prescriptions for psychiatric drugs such as the stimulant Adderall, is used to treat ADHD, and the anti-anxiety drug Xanax. The pharmacist spoke on condition of anonymity for fear of harming their business. So the wholesaler says, "I'll cut you off. I'm not giving you anything anymore because you're prescribing, like, you're filling scripts of medication that were prescribed by a doctor." Adderall specifically is already like a difficult drug to get your hands on. It has a lot of stigma around it. Xanax as well too. And this has made it worse in time. These psychiatric drugs are regulated by federal government as controlled substances that have high potential for abuse and addiction, but are not opioids. The wholesalers imposed bans because the pharmacies had filled prescriptions written by medical practitioners who frequently prescribed controlled substances or had filled prescriptions assigning both a stimulant and a sedative to the same patient. Now, you can be a doctor who specializes in ADHD. That's a thing. In fact, it's a very lucrative type of doctor in a lot of places. But that would qualify you as someone who routinely subscribes a controlled substance. And that would flag for the wholesaler. And beyond that, you can, like, there are very valid reasons to give someone a stimulant and a sedative. That doesn't mean they take them both together. Someone can have ADHD and they take a stimulant, but then they also have anxiety. So they have, and you're not even supposed to take like Xanax or anxiety drugs like that every day. Those are they would have diminishing returns. Those are an as needed type of thing. So if you need them for sleep occasionally because your ADHD meds are keeping you up, or if you have an anxiety attack because it increased your anxiety, or maybe you just have anxiety and you occasionally have anxiety attacks, or you have stressful situations and you need them, suddenly you are flagged as a potential drug abuser, and your pharmacy is flagged for supplying it because your doctor was flagged for prescribing it. And all of this comes from the stigma from the opiate epidemic. There it needs to be a middle ground here. I'm not saying that, we should freely prescribe these drugs just like we were easily giving out oxycodone like it was candy, but a middle ground is important. There are people who legitimately need these medications. There are people who legitimately need opioid medications. They have chronic pain and they can't get their hands on them because of the stigma around opioid medications. There are people that actually would benefit from them, that need them, that have valid reasons, that aren't being pushed on them by pill mill doctors, but have difficulty going to the pharmacy and filling their prescription for opiates. They get judged, they get dirty looks. The pharmacy is often afraid and will refuse to fill the prescriptions. Like, it is a complex net of stigma that has arisen from this issue, and it affects millions of people, and it affects their lives, their health care. Like, ADHD is not. I'm gonna go more into this when I do my bit on mental health, but ADHD is a debilitating condition if it's unmedicated. Executive dysfunction is one of the key symptoms there. And executive dysfunction means you want to do something, but you cannot physically get up and do it. Now, think about how that would translate into somebody's ability to work. If they have ADHD and they can't fill their medications because they're being flagged, that means they are no longer taking their medications, and this affects their ability to work. This lack of ability to work affects every other aspect of their life. It's unethical just to simply disallow all these drugs. There needs to be a more guidance. Like, the USDA identifies combinations of prescriptions as of stimulants and sedatives as a red flag in its guidance pharmacies on illicit drug use. This is wrong. Three psychiatrists interviewed by Reuters described such combination prescriptions as medically valid and dispensed routinely for years to manage comorbidities and to address stimulant side effects like insomnia. Comorbidities refer to the simultaneous presence of two or more diseases or medical conditions in a patient. An ADHD patient taking Adderall to focus during the day might need a sedative to sleep at night, as I said. Matthew Goldenberg, president-elect of the Southern California Psychiatric Society, a chapter of the American Psychiatric Association, said some members have complained that pharmacies were no longer comfortable filling prescription combinations for controlled substances because of concerns that they could be blacklisted. This is detrimental, quote, to potentially many patients who have a comorbid anxiety along with ADHD or sleep issues along with ADHD. I think it's a trickle-down effect from opioids. And again, this isn't going into the people who actually need opioids and have trouble getting them for the same reasons. The impact on independent pharmacies of psychiatric drugs from the widening crackdown on opioids has not been previously reported. There are just over 19,400 independent pharmacies in the US, representing 1/3 of all retail pharmacies. The 5 pharmacists interviewed by Reuters said wholesale bans on supplies of controlled substances threaten the viability of independent pharmacies while letting chains like CVS Health Corp and Walgreens off the hook. CVS, the biggest US pharmacy chain, did not respond to requests for comment on the story. Walgreens, the largest shareholder in AmerisourceBergen, which again was one of those pharmaceutical companies that agreed to pay part of that $24 billion settlement for their role in the opioid epidemic, declined to comment. Reuters was unable to determine what degree these chains have been impacted by the enhanced monitoring. The U.S. opioid crisis has caused nearly 650,000 opioid deaths since 1990s. Again, this is 2 years ago, so that number would be worse now. Over the past 2 years, 3 drug wholesalers agreed to a series of settlements totaling billions of dollars. We went over this. Yeah. As I said, the stigma that has been produced by the opioid epidemic has resulted in people who actually can't get the medicine that they need. We need structural foundational changes to the healthcare system. And this is only just the beginning of it. Like, we've only just touched the surface here. The opioid epidemic is a system of the larger endemic problem in our healthcare system. It's baked in to the system of how it works. This was an unavoidable outcome under the regulations that we have and the under regulation of these pharmaceutical companies, of the incentives that they have to behave the way that they do, and how we treat drug addiction in this country, how we treat healthcare in this country in general.